much better now that it's finally nice and sunny and not snowing like it has been for about 4 months now.
I know, finally some sunshine.
Yeah, were you able to do anything outside today?
It's still a little cold out, but I tried going for a walk with my dogs.
Yeah, I know. At least it's not raining or windy or anything like that.
Yeah,
so I can deal
some of the sunshine.
As long as it's sunny, I feel like I can deal with anything. So what we're gonna do is, we've done the pain rating scale before. That's just where you sort of rate your pain. 0 is no pain, 10 is we have to leave and go to the emergency room right now. So currently, what are you at?
My back is just really painful today. I would say probably like a 6 or 7.
A 6? Okay. So since you are in so much pain right now, I'm gonna go ahead and do the moist heat packs. I think we did those before. Is that okay with you? All right. I'm gonna have that really good.
Yeah, my back's been really acting up lately.
Yeah. Has it been as bad as it was last week, or do you think it's getting any better?
It has its days. It really gets worse when I get at work, sitting at my desk all day.
Yeah. All right, so I have the towel over the pad, so it shouldn't be too hot. Go ahead and lean forward for me. You can lean back. How does that feel? Yeah, it's really not too hot? Okay, I'm just gonna start my timer. We'll check it in a couple of minutes. If you start to feel any discomfort or if it gets really hot, just let me know and we can take it off. But we'll go ahead and start that. So I just want to hear a little bit about how your pain's been. I know you said it's been bad this past week. How often do you really experience it?
It really gets bad as the day progresses.
Okay.
When I wake up in the morning, it's kind of stiff, but it loosens up a little once I get walking around. And then I go to work, and if I'm sitting in my chair too long, kind of gets stiff.
Okay.
That's when it really starts bothering me.
Do you really get up and take breaks at work, or do they require
I
you
try to, but with the amount of work I have, because I have to do a lot of paperwork since I'm a secretary for the doctor I work for, it's really hard because if I stop and take breaks all the time, then I get behind and stuff. So I try and take breaks, but sometimes it just doesn't happen.
Okay. Do you notice any specific things that really trigger it or really make it feel bad, or does it just get worse throughout the day?
It really triggers it when I'm sitting at my desk all day, really.
Right. Okay. And anything that really makes it better? Do you take medications? I don't know if they prescribed you.
I have some pain medications, but I don't really like taking them that often because it makes me feel like weird and tired.
Okay.
And I can't be tired when I'm at work, so I don't really take them that often.
And how about when you're not at work? How about at home? Anything specifically?
No, I have this back massager thing that I put in on my couch.
Those are
It's
the best.
it's really nice. I try and use that to get the stiffness away.
I love the ones at the nail salon where they do that, but then the one setting feels like someone's punching your back. So I don't like that one so much. But okay, so we already had the heat pad. That's one method that you can use to decrease pain. It helps to decrease stiffness, release muscle spasms, increase the blood flow to the area. So that's why we do that. If you wanted to do it at home, you have the option to do so. I know they make those rice pack ones that you can microwave. You just have to be really careful and make sure it's not too hot and that you're not putting it directly on your skin. So like we did, you just wrap it in a towel. And if that's something you're interested in, we can look into making them, maybe do that as an activity.
Yeah, I have one that's smaller that I use for my neck sometimes.
Yeah.
So I could probably just make a bigger one.
So you're familiar with it. All right, that sounds good. So I wanted to talk a little bit about the work site evaluation we did last time. It was really cool to get and see you.
Everyone loved you.
Yeah, it was so fun. I love going to people's jobs and creeping on them a little bit. But one thing that we talked about was your desk layout, how you don't have a swivel chair, do you?
No, I just have a standard chair like this.
I remember the measurements and everything looked right. You had that 90, 90, 90, so your knees weren't too bent or anything like that, but think how your layout was. You had your phone sort of over here, your computer over here, some papers, so when I saw you, you were really twisting and doing things like that. And I know that's one way to really straighten your back, and I see from you having so many work-related incidents that that's probably what's happening.
Yeah.
So I just wanted to talk about maybe structuring at your desk. I drew a little picture, maybe might be a good idea. If we have your desk, and then if you sort of moved your phone closer, or if you had maybe a place to put your papers rather than having to go back to that table that you did all the time. I don't know if your work would be too into getting you a swivel chair, but I think that could really help you so that you're not constantly turning and twisting and putting so much torsion on your back.
Yeah, I feel like I could just personally buy one.
Yeah, and then we can adjust it and make sure all the measurements are right. I think that would be something to really help.
Yeah, I know they sell some swivelly chairs at like Sam's Club, like some places like that, Costco. So I could definitely put money into that.
Okay. How are you feeling with the heating pad?
It's really good. I can feel the heat really.
Okay, so no uncomfortable, nothing too hot.
Feeling a little looser now, which is nice.
All right, perfect. Let me know if it's uncomfortable, but since you are so loose, maybe we could do a little bit of like body mechanics, if you'd be okay with that.
Yeah.
So what you want to do, we already talked about the ergonomics and not like twisting and things like that, but you're going to have times where you have to pick something up off the floor. So it's really common for people when you drop something on the floor, you just go down and pick it up. But that is putting so much pressure and strain on your back. So I brought something heavy for you, not super heavy, to try and pick up. Just this suitcase. If you went down like this, you'd be putting so much pressure on your back when you come back up. So what you really want to do is keep your back sort of in neutral and bend at your knees, pick it up, and then use your thighs to push you up instead of using your back muscles to lift you all the way up. So I'm going to have you try and pick this up for me.
Do you want to take this?
Yeah. Okay, so you just want to position yourself properly beside it. Yeah. And then you're going to bend at your knees rather than at your back.
Like this?
Yeah. And you're going to try and keep your back as straight as possible.
Like that?
There you go. And then...
It feels a little awkward, but I think just because I'm so used to doing it the other way.
It definitely is awkward, and it looks super awkward because no one picks things up like that.
Yeah.
But it's so much better than going back, going forward.
Do I do the same thing when I put it down, too?
Yeah.
Yeah. It'll just get some taking used to, I think.
But it's definitely a lot safer of a way to do lifting and things like that, whether it's at home or at work. If you're putting laundry away, you don't want to bend down and do that. Just get on the level.
Yeah, I know, because when I do laundry, I just bend down like this.
Exactly.
To pick the
Everybody
basket up.
does.
Can I try it with this, like the front way?
Yeah.
Yep. Am I doing it right?
You're still bending your back a little bit, but that's natural. You just
Okay.
want to try and keep your back as straight as possible.
Okay.
So go ahead and put it down.
Is that good? Because it's a little heavy.
Yeah. It'll just take some getting used to, and we can practice that.
Okay.
And then another thing I wanted to try with you, if you're okay with it, was just some sleeping positions, because you said you have a lot of pain and stiffness in the morning. So I have a handout that I can give you later, but I'm just going to go through them really quick.
Okay.
We can go over to the bed here. What's your normal sleeping position?
I usually fall asleep on my stomach, which is weird, but then I usually end up on my side somehow.
I have no idea how I sleep because I always wake up in a different position than from how I went to bed. But if you want to get on your stomach, go ahead and lay down like you usually do. So one way that we can decrease your pain and stiffness in the morning is by adapting how you sleep. So one thing is to put a pillow underneath your legs, your lower legs. Can you lift your legs up for me? All right, you can lay them back down. How does that feel?
That already feels a little better.
Yeah. And then one more. This might not be super comfortable, so you don't have to do it if you don't like it, but it's to put a pillow underneath your stomach. So do you just want to put that? helps sort of keep your back and your spine in a neutral position rather than putting different forces on it. When you do that all night, it really adds up and gives you a lot of pain and stiffness in the morning. But these might not work for you. That's just something that you have to decide for yourself. But they'll definitely help you if you're able to implement them.
Okay, yeah, I'll definitely try it at home.
Okay, you look super comfy and
I know, I could fall asleep.
Okay. Well, you can go ahead and get up. And then, like I said, I have these handouts for you. Let me go grab it. You can come back over. Here is the ergonomic handout. It just talks about keeping your back straight when you go down, and then also the things we talked about, like the not twisting and turning and things like that. So do you have any other questions for me?
I think I'm good.
Yeah, any concerns or anything like that?
Nope.
Okay, well go ahead and try these things out, and I'll see you again on Friday.
Yeah.
So if you're having any trouble, if you find something that's really giving you a lot of pain, just let me know and we can definitely work on it next time.
Awesome.
Okay?
Thanks for your help.
Yeah, no problem. All right, thanks.
Thanks.